Well, hello, everybody out there, and thanks for listening to our podcast here, Sit or Start. What we do here is we talk about recent injuries in the NFL. I'm Shannon O'Kelley. I'm a physical therapist, and I'm joined by Dr. Hawkins, orthopedic surgeon. Dr. Hawkins, how are you?
I'm doing wonderful this morning, trying to stay dry with this atmospheric river going.
Yeah, the cyclone bomb, whatever they're calling it. You know, there have been a lot of games in NFL last couple days that have had a lot of rain, including the Seahawks on Monday night and some other ones that I saw. You know, that rain kind of creates injuries. I mean, a slippery turf, muddy turf, whatever it is, you know, footing, just slippery balls, people, hitting, all that stuff. I mean, it kind of susceptible to injuries. We're going to start out with a couple injuries here. And one big injury, I think it is Zach Wilson. He's a rookie quarterback for the New York Jets, and Zach had an injury. And let's talk about that. Tell us about that injury.
Yeah, essentially, he's a young quarterback who likes to, be a bit mobile. And unfortunately, he had an injury where he came down directly on the front of his knee with his knee bent at 90 degrees. And he suffered a sprain of his PCL, his posterior cruciate ligament. So that's a pretty well explained phenomenon. Happens actually a fair amount in football players, a lot more than people understand. It's actually the number one undiagnosed injury that pops up at the NFL Combine every year when guys are coming out of college and getting checked out for the draft. So it does happen quite frequently. That PCL ligament is sort of the opposite of the ACL, which everybody hears about. And it's not completely torn a lot of times. So he actually sprained it, which typically means that, he had some pain, had a little bit of swelling, and they probably got him an MRI and saw that the ligament itself looked as though it had been stretched or pulled a little bit. So it's a big injury for a guy like him because of his mobility, but shouldn't need surgery. And ultimately, it's typically his return to play will be determined by how his swelling and his range of motion improves.
Yeah, so the PCL is not, like we hear about the ACL, like you said, all the time. The PCL is a common injury, goes undiagnosed. It's just not, to describe it as a stabilizer in the knee, and maybe just how can this person, this athlete, get back to play if they have a sprained or stretched PCL, where they may not be able to do that with the ACL. So it's a better injury to have. I think it's better to have a PCL versus an ACL, but tell us how the stability works and how players can get back if that ligament is stretched or torn or sprained.
Well, it's significantly larger and thicker than the ACL. So that's why these sprains tend to occur where it doesn't tear completely. The second thing is that it's technically an extra-articular ligament, meaning the ligament actually passes outside the lining of the joint itself. So it has a much greater propensity to be able to heal if you protect it, whereas the ACL runs completely through the joint itself, and so its healing potential is very minimal to nothing at all. So that's one of the big differences. The second thing is the way it's oriented. It's not as important from the standpoint of twisting and pivoting in the knee. So there's been a couple NFL players, I believe Jeremy Shockey, who played for the Giants for a lot of years as a tight end, and I believe Marshall Faulk as well, were both some high-level guys that actually played their careers with PCL injuries that were significant and never had surgery. So, that just kind of shows you how you're able sometimes to really compensate for these injuries much better than you can with regards to those ACL injuries.
Yeah, exactly. So you think Zach Wilson, most likely, if it's a sprain, a little stretch to that PCL, they're going to calm it down. Again, we're talking biology. What about 4 weeks possibly? Is he out about 4 weeks, you think?
Yeah, I think they'll probably accept putting him in a brace and probably try to get him at 3 weeks. That would be my guess. They'll put a Tom Brady bulky brace on him and just ask him not to scramble as much. That would be my guess, and try to get him back about then. But 4 weeks, that's definitely a possibility if he's still having some swelling and pain.
Okay, the Jets could use him, that's for sure. Okay, 4 weeks for Zach Wilson. He is sitting. Jonnu Smith, tight end, New England Patriots. Shoulder injury, most likely something like an AC injury, I thought I read. But let's talk about Jonnu Smith, New England Patriots. Let's tell us what's going on there.
The speculation is that it's AC based upon the fact that he had a interesting play where he caught arms with another person, kind of tried to stiff arm, and then kind of went down a little bit awkwardly with regards to the tackle and the fall. So the AC joint is basically where the end of the collarbone attaches to the top of your shoulder blade. So it's not a joint that moves significantly, but it's important from the standpoint of stabilizing your shoulder. So when you move it around and reach places, you're not able to, when you sprain it, you're not able sometimes to do it without a lot of pain. So these injuries, as long as there's not a complete tear, and that's called a separation when you completely tear the ligaments there. If it's just a sprain, it's usually a pain generator. And this is one of those injuries that sort of the old school get a shot and play in the NFL guys is actually done pretty commonly.
Yeah, but this guy's a tight end, and you described this joint injury, and it's in different various levels. I mean, it's not, the bones are probably not completely separated. It's the ligaments that are probably irritated and torn, but the pain is significant. But what about a tight end reaching up and moving his shoulder to catch overhead balls and blocking? That's painful. I mean, is this guy out for until this heals? Is this a 4 to 6 week thing?
No, I don't think so because of the fact that it was a sprain injury. I think for him, I think that what they're going to end up doing is probably if he's having any pain, they will probably consider just giving him some medication and potentially giving him an injection at that joint before the game and having him play, as long as on examination he doesn't show instability there, meaning what you were intimating, ligament damage.
Right.
If it's stable, if the joint's stable and just painful, they will oftentimes inject it. They'll have him place a pad over the top of it. The injection will allow him to reach overhead to do those catches, and they'll probably try to run a scheme where he's not blocking as much, so he's not taking hits onto the top of the shoulder. But he was having a good game, so I think they'll try to get him back sooner rather than later.
So you're thinking sooner, potentially if everything goes well and it's healing and the pain is controlled and he can be functional. I mean, this guy is gonna play next week, this coming Sunday, so to speak. You think?
Yes, I do believe he'll be in.
Okay, all right. So he's starting. That's great. Thank you, Josh Jacobs, running back, Las Vegas Raiders. I always have a hard time with that, remembering they moved to Las Vegas. And so what's going on with Josh Jacobs? I mean, chest injury, that's a lot of stuff could be going on there. I mean, a contusion to the sternum, ribs. What do you think?
Yeah, I think the way he came out of the game, I think what they might have been concerned actually was that he had a pec injury. So his pectoralis major is your big chest muscle, and that's got a tendon that attaches to your upper arm. And I think the concern and the reason they took him out was that they were concerned that tendon might have been injured. The good news is a lot of times those are injuries in the muscle itself and not in where the tendon, which is the ropey end of the muscle, attaches to the bone. And so those, as long as it's just like a contusion in the muscle, those come back relatively quickly. So I think he got lucky. I don't think he tore the tendon off the bone. That would have been a season-ending injury. We see that a lot in linemen. And I think he will probably be playing. I'm not 100% sure. I think they might be on a bye week this week. So if they're on a bye, then he's definitely back at the next game.
So it's a 2-week sit with the bye, and then he's going to start next week. Not this week, but the following week. So you think he's going to start, be back in 2 weeks, and it's a healing process, and not a 4-week, 3-week, 4-week thing. He's back the next time they play. Dr. Hawkins, I want to talk about Dawson Knox. We haven't done a lot of hand injuries, but, we see a lot of injuries, obviously, right here in the Puget Sound. Seattle, Russell Wilson is a big hand injury affecting the team significantly, I think. Let's talk about Dawson Knox, tight end for the Buffalo Bills. Had some kind of hand injury, but they did surgery. Tell us about that.
Yeah, it was actually pretty impressive. He actually injured his hand in a game 2 weeks ago, and he then actually was in the game, and they ran a gadget play where the quarterback ran the ball out, the old what they called Philly special from a few years ago in the Super Bowl, and he actually threw a pass, and he looked like a 5-year-old trying to throw a football because his hand was broken, but he actually completed the pass. So he had a fracture. It's in his dominant hand. He actually underwent surgery that week. And so typically in those situations, that most likely involves an injury probably to one of the metacarpal bones, which is in the palm of your hand. So those are bones that you can plate them. You can get some screws in them that give them really good stability, and it doesn't affect too much of the function and the motion, unlike Russell's injury, which was at the tip of the finger.
Right.
And because he's a tight end, even though it'll impact his ability to catch the ball, they will probably get him into some type of a protective brace or splint and get him back. I think the anticipation is that he's going to be practicing this week, probably with that brace or cast on, and then hopefully playing in 1 to 2 more games. So a much different recovery time than Russell has.
So you're expecting Dawson Knox, tight end Buffalo Bills, out for 2 weeks, at least 2 weeks, with a return to play with some kind of protective splint, brace, or cast?
Yes.
Okay, all right. There you go. We've covered some injuries. We've talked about some return to play. Look forward to joining us next week. We will review future injuries in the NFL. Dr. Hawkins, thank you so much for your time. Excellent information. Like I said, I always learn so much talking with you, and I enjoy our conversations. Thank you.
Yeah, this has been great.